Prof, a very good morning. You've got a blog. I'm looking at your blog just now, and you say one-size-fits-all approach to combating COVID-19 could lead to dire consequences. And you start by talking about social distancing on the African continent, specifically in South Africa. Why do you think it won't work?
Well, insofar as social distancing is keeping people that are infected away from people that are not infected, social distancing will, of course, slow the spread of the disease. The question is not so much a matter of whether social distancing works, but a matter of whether it's always possible. And in the African context, particularly within the high population density townships, such as Khayelitsha, that we've just had our first infections there, social distancing or successful social distancing is just not going to be a measure that's really successful. Certainly not to the extent that it will mitigate the negative effects of the kind of lockdown that might be enforced there. So although social distancing may well work in Europe and in other contexts, in the kind of environment where many South Africans live, where there's 10, 15 people living under a single roof, it's just not going to be possible to enforce the kind of social distancing that might be successful in other regions.
Prof, you go further to say that it may actually cost lives. That's
right. So imagine the situation in Khayelitsha now. People are locked down. They're unable to, not legally. The majority of the population there work in the informal economy, where their job might just be 200 yards down the road selling goods on the streets, non-basic goods. The entire informal economy shuts down. Now, when an economy of any kind shuts down, income reduces, and when income reduces, money that's available for food and basic goods goes away, and of course that opens the door to hunger, starvation, and so forth. So the negative effects of implementing ineffective public health measures can be severe.
We've already started seeing in Italy, for instance, where when you talk about hunger, in the south of Italy, there are communities there where they're starting to raid supermarkets, they're starting to break into stores purely because of hunger. Do you think this might lead to social unrest on an African perspective?
I think, the authorities here must anticipate such a move and try to put in measures that will prevent such a move. So, you must, when you're looking at your law enforcement, you should look at the kind of measures that are going to be effective. Now, once a virus is in a township, it's going to be very difficult to help the spread. Social distancing, effective social distancing, is almost impossible. But nevertheless, the police focus their attention on preventing the spread between one township or settlement to another, and there are thousands, of course. If the economies if the smaller economies, if the informal economies within those townships are allowed to continue, then hopefully we won't end up in a situation where there are raids in the first place, because people will have a little bit of money. The supermarkets aren't short of food. The problem is going to be caused by a lack of resources, and if an informal economy is allowed to continue, but restrictions are placed on travel in between townships and informal settlements and so on, and of course, the epicenter of this thing is Sandton. Let's not forget that. So long as people are restricted within the region, then hopefully we can slow the spread of the virus sufficiently without affecting the economy too much. So what I would urge is to focus the police capacity on social distancing between different regions rather than within, say, Khayelitsha or Alexandra or so on.
Interesting take. And lastly, because our line is not the greatest, you also go on to say that even if we flatten the curve, you ask the question, will it make a difference? Do you think it won't make a difference?
Flattening the curve. Okay, so the general idea is that if you flatten the curve, you reduce the burden on the health service. Now, if you can reduce the burden on the health service, then there's more beds available to treat more patients. So in that particular instance, yes, of course it makes a difference. However, for those people that don't have access to medical care anyway, it makes no difference. So this is the issue we're trying to make, we're trying to raise. So if you're in a rural area and you don't really have access to good medical care anyway, flattening the curve won't make much of a difference to you. Again, like in most situations, this is unfortunately going to affect the poor more than it is anyone else.
All right, interesting take. You also, in your blog, you focus a lot on the children, the effect that COVID-19 might have on the kids. When you look at the fact that a lot of kids on the African continent, here in South Africa, in the poorer areas, in the rural areas, are being raised by the elderly purely because of the devastation from HIV/AIDS. That particular pandemic, why are you focusing on kids? What do you think might happen when it comes to the children of our nation?
Well, the children haven't been affected so much by, certainly not by the effects of COVID-19, right? So very few, if any, children under the age of 10 have died from COVID-19. However, of course, hunger affects everyone, right? So stopping the spread of COVID-19, the measures that are put in place there might affect the economy to the extent that it causes hunger in children in a way that children wouldn't be affected by getting the disease itself, because children simply aren't affected so badly by this disease. It's a disease that affects the elderly more than it does children. So we're protecting children by protecting the economy.
Okay, interesting take. Lovely talking with you, Benjamin Smart, Associate Professor from the University of Johannesburg.